What's going on, everybody? Today we're going to be talking about antidepressants. People with depression often experience prolonged periods of sadness, often without any reasoning. This is characterized as depression. Neurotransmitters serotonin, dopamine, and norepinephrine have been shown to play a major role in happiness and well-being. So when a person has low levels of these neurotransmitters, it's often associated with depression, and they might feel feelings of sadness, anxiety, and worthlessness. So antidepressants are aimed at correcting these low levels of neurotransmitters. So the first class of antidepressants we're going to be talking about are TCAs. TCA stands for tricyclic antidepressant. This is a first-gen antidepressant. Some common names are ipramine, amitriptyline, and doxepin. So for the patho on tricyclic antidepressants, TCAs block the reuptake of norepinephrine and serotonin, which prolongs the amount of time neurotransmitters spend in the synapse. TCA binds to serotonin and norepinephrine transporters on the neuron and inhibits it from reuptaking the serotonin and norepinephrine in the synapse, which means more serotonin is available in the synapse to stimulate the postsynaptic neuron and send more messages, which is going to lead to increased happiness. Alright, so we're going to be talking about the pharmaco of tricyclic antidepressants. So TCAs are absorbed in the GI tract. They peak in 2 to 4 hours. They're metabolized in the liver, and one thing to note about these drugs is they can have very long half-lives of 8 to 46 hours, which means it can take a very long time for these drugs to reach therapeutic levels in the bloodstream.
So some contraindications for the tricyclic antidepressants, we have allergy, obviously, and English words if you're allergic to it, don't take it. Recent MI, because there's potential for reinfarction, if I'm saying that correctly. Pregnancy or lactation, that's kind of a given. And then myelography, that's a diagnostic test that uses some contrast and stuff, so you don't want to mix that with TCAs. So some adverse effects of TCAs, it's because of the effects on the CNS. So there's dry mouth, blurred vision, sweating, drowsiness, and then increased heart rate.
Okay, with TCAs, there are nursing considerations. We should begin by assessing the vitals, the weight, level of conscience, and the reflexes to get a baseline before the therapy. Because this is an antidepressant, you want to assess the history of seizures. You want to educate your patients on the black box warning of risk for suicide. Also educate your patients that it will take 4 weeks for a therapeutic effect. If there are severe anticholinergic effects, you want to administer this medication at night. Also, teach your clients that gradually tapering off the med is safer to prevent any adverse reactions. And for your female patients, if they are, it's contraindicated in pregnancy, so if they are using contraceptives, teach them to use another barrier, another form of it, and always teach your patients comfort measures and patient teaching.
Alright, so some cautions and adverse effects, a little mnemonic to help you guys remember this drug is SAD hops, antidepressants, make the connection. So the S stands for suicidal risk. There's a suicidal risk when it comes to antidepressants. An adverse effect is the anticholinergic effects, and we all know, can't see, pee, spit. We all know the last one. Another adverse effect is dysrhythmias, and Lauren mentioned earlier for MI. Hallucinations, orthostatic hypotension, and then P is for pregnancy precaution. Don't administer if the patient's pregnant. And the last adverse effect is sedation.
Our second class of antidepressants we're going to be talking about are the SSRIs, which stands for selective serotonin reuptake inhibitor. Some common names for the SSRIs are fluoxetine and sertraline. So the patho of SSRIs are how they work. So they block the reuptake of serotonin in the synapse. So the SSRIs work here, and they block these presynaptic neurons from reuptaking the serotonin, which leads to an accumulation of the serotonin in the synapse. which means more of the postsynaptic neurons can reuptake or can use the serotonin, which means more messages of happiness are going to be sent throughout the brain, which is going to lead to reduction of depression symptoms. The pharmaco behind SSRIs, so they're given orally, they're metabolized by the liver, and inform your patients that it may take up to 4 weeks for them to become effective.
So some contraindications for the SSRIs, we have known allergy. If you're allergic, don't take it. Pregnancy or lactation. Some of the things with pregnancy with antidepressants and other mood stabilizers is the risk versus benefit. So if there's a mom who needs to be on an SSRI to protect her safety or her infant's safety, it might be worth it to risk the harm to the fetus. And then impaired renal or hepatic function, because it could interfere with the metabolizing and excretion of the drug. So some adverse effects of SSRIs, they cause like sedating effects, like downers. So you have drowsiness, dizziness, dry mouth, impotence, which can interfere with patient compliance with the drug, and then impaired renal or hepatic function, like we said earlier. A lot of these adverse effects will stabilize and decrease over time, so that would be something to let the patient know.
Okay, with SSRIs, you know that there are nursing considerations. So of course, we want to start with assessing the vitals, the weight, the level of conscious and reflexes of these patients to get a baseline before beginning therapy. Assess these patients' history of seizures as well. With elder clients, you want to start them with a lower dose if they do have renal or hepatic impairment. Teach these clients that it will take 4 weeks for the therapeutic effect. Of course, always educate your clients that there are black box warnings of risk of suicide. For your female patients, teach them to use another contraceptive. For your male clients, you want to teach them that they may experience sexual dysfunction. And always provide comfort measures and patient teaching.
Alright, so a great mnemonic to remember the side effects of SSRIs is just the name, SSRI. S stands for sexual dysfunction. The other S is for suicidal risk. R is for rising and dropping weight changes, because there's a fluctuation with weight. And the I is for insomnia. A great mnemonic to remember serotonin syndrome is serotonin. S is for seizures, E is for elevated temp, R is for rising blood pressure, O is for open and dilated pupils, and that's a huge indication that you're experiencing serotonin syndrome, as well as T, which is for tremors and twitching. O is for overly active, so hyperactive. N is for nausea and vomiting. I is for increased heart rate. And N is for not oriented, so disorientation.
So our next class of antidepressants we're going to be talking about are our MAOIs. This is also a first generation antidepressant. MAOI stands for monoamine oxidase inhibitor. From my understanding, these are very rarely used today because of some of the side effects and interactions that they have. But the patho behind MAOIs, so monoamine oxidase is an enzyme that breaks down neurotransmitters. So MAOIs prevent monoamine oxidase from breaking down neurotransmitters, and this is going to lead to higher levels of neurotransmitters in the brain, correcting those low levels of neurotransmitters, leading to depression.
So some contraindications for the MAOIs, we have allergy, of course, pheochromocytoma, which is a tumor on the adrenal gland, and that can cause, MAOIs cause a sudden increase in norepinephrine levels, so that will affect that negatively, and it affects everything else in the body. Cardiovascular disease could be exacerbated with MAOIs, headache, or renal and impairment functions. Renal or hepatic impairments. Adverse effects, there's a lot of them. There's a lot more than with other antidepressants, and some of them are potentially fatal. So some of them include dizziness, excitement, nervousness, mania, hyperreflexia, tumors, confusion, insomnia, agitation, liver toxicity, which is a big one, nausea and vomiting, diarrhea or constipation, anorexia, weight gain, dry mouth, or abdominal pain.
So for our MAOIs nursing considerations, we want to start off with assessing the vitals, level of conscious, weight, and reflexes to get a baseline before starting therapy. Assess these clients also for suicidal ideation. Teach these clients that it may take 2 to 4 weeks for therapeutic effect. Remember to carefully monitor the blood pressure because you do have the risk of the hypertensive crisis. And remember that phentylamine, you want to keep that on standby in case that does happen. Assess these clients for liver function. If there's any signs of liver toxicity, you want to discontinue this medication right away. Teach these clients that they should avoid foods and entirely, such as like fermented cheeses or smoked meats. And always support and do patient teaching.
So a great way to remember the tyramine diet that you have to be on if you're on MAOIs is tyrames. T is for tofu. Y is for anything with yeast in it and yogurt. R is for round avocados, just avocados. A is for aged cheese. M is for meats, especially the smoked meats. E is for ETOH, which means alcohol, so beers and wines. And S is for soy sauce.
Alright, so anxiolytics are used to treat anxiety, and anxiety is characterized by feelings of tension, apprehension, and fear. And benzodiazepines are used to reduce levels of anxiety. So our benzodiazepines, some common names, alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. So the patho of benzodiazepines. So GABA is a neurotransmitter that inhibits CNS responses to anxiety-producing stimuli. So benzos increase the effectiveness of GABA, which means a reduction in anxiety stimuli. So simply put, benzodiazepines act as an agonist on GABA and increase the effectiveness of GABA, leading to kind of like a sedating, calming effect on the CNS, and this decreases anxiety. Benzodiazepines are more sedating in higher doses. As far as the pharmaco for benzodiazepines, they're well absorbed from the GI tract. Peak levels occur in 30 minutes to 2 hours. They're lipid soluble and excreted in the urine. So benzodiazepines, they act fast and they're excreted fast.
So some contraindications for our benzos, we have if someone has an allergy to any benzodiazepine, psychosis, shock, coma, acute narrow ankle glaucoma, alcohol intoxication if they're currently intoxicated, because all of those can be exacerbated by further depressive effects, which benzos have. And then pregnancy has a lot of adverse effects on the infant if someone were to be taking benzos throughout the pregnancy. So those include cleft lip, cardiac deficiencies, or neonate withdrawal syndrome if the mother is on benzos throughout the pregnancy. Some adverse effects to benzodiazepines. These are all the depressive effects caused by the CNS and peripheral nervous system downers. So that includes just kind of sedation, lethargy, depression, blurred vision, confusion, dry mouth, nausea, vomiting, hypotension, and urinary retention.
So for our benzos, nursing considerations, always remember to assess the vitals, level, conscious, reflexes, and weight before starting therapy to get a baseline. Know that this does treat status epilepticus. You want to monitor these patients on benzos for renal and liver. If you have the patients on IV, you do want to have this drug administered slowly. Do not mix IV medications with one another, and know that you should always monitor the site for any signs of infection. Teach your clients that after they take this med that they should be in bed for at least 3 hours. Also teach them that taking this med, they can develop dependence intolerance. And if stopped abruptly, you want to teach them that they may experience withdrawal symptoms. So you want to taper off the drug and not stop abruptly. And of course, always provide comfort measures and patient teaching.
Okay, so a great way to remember the indications of benzodiazepines is to remember the mnemonic benzo bear. So BEAR is the mnemonic. So B for breaks active seizures, E for ETOH, so alcohol withdrawal, A is for anxiety, and the R is so you can remember the reversal agent, which is flumazyl. Then you have the benzo there.
So our second anxiolytic is barbiturates. This is an old school drug that is sometimes used to treat anxiety. Some common names: pentobarbital, phenobarbital. The patho behind barbiturates are how they work. They act as a general CNS depressant by inhibiting impulse control in the RAS. So a depressed CNS means less anxiety. As far as the pharmaco of barbiturates, they're well absorbed when given orally and begin working in 30 to 60 minutes, but they don't reach peak effects for 10 to 12 hours, so it's a very long-acting drug, metabolized in the liver. And the main nursing consideration with barbiturates is you don't want to combine it with any other drug that's going to depress the central nervous system, such as alcohol. That's the end of our presentation, guys. Good luck on your finals.
Good luck, guys.
I'm writing about depression. It's a period of prolonged sadness without any reasoning.
Alright.
Low level oh my gosh.
You should consider, we can start with assessing the vitals, the weight, and the low, beginning of therapy. And because this is an what is it? Depression. I got it. I just want to make sure.
Yeah, I did this.
So there are some nursing no, it's not.
No, it didn't go.
Oh, it sounded like it's going.
Oh, it's going?
Mhm.
Alright. Alright, so some cautions and adverse effects, a little.
Benzodiazepine, psychosis, acute narrow angle glaucoma, shock. Okay, can I just?
No, you gotta go with it. I had to go.
Teach your patients, comfort measures, and patient teaching.
Oh my gosh, my arms were getting tired there at the end. That's the end of our presentation, guys. Good luck on your finals.
Good luck, guys.
There we go.
Awkward.